Centers for Disease Control and Prevention sponsored study to establish a national surveillance system for chronic kidney disease in the United States. In addition, he leads a national study of CKD patient outcomes called CHOICE, funded by the AHRQ and the NIDDK.
He doesn't wear a mustache.
Across the career has produced more than 350 publications. Dr. Powe has provided exceptional insights into factors that affect kidney disease patients. His noteworthy studies cover virtually every area of clinical care, from the impact of early referral of kidney disease patients to patient-physician contact in dialysis care. With his dedication to uniting medicine and public health in order to save lives, Dr. Powe's work continues to advance patient care and improve the clinical practice of nephrology.
Ladies and gentlemen, Dr. Neil Powe.
Is it bacon? It's blinking, right?
Thank you for this very special honor. When you pose a research hypothesis or design a new study, your hope is that that's been my passion for all the work that I've done. When you see a turtle on a fence post, you know he didn't get there by himself. My passion has been inspired by several mentors, colleagues, and trainees. In particular, I'd like to point out a few individuals who were instrumental in nurturing me. First, Barry Brenner, who during my third year medical school clerkship was my attending on the internal medicine service. And he instilled in me a lot of nephrology during that month. In fact, I learned mostly nephrology during that month. And Eric Nielsen, who a few miles from here at the University of Pennsylvania was my first attending as an internal medicine resident. And really it reaffirmed my commitment during a hard internship year to continue in internal medicine. Paul Welton, when I arrived at Johns Hopkins, mentored me in the rigors of clinical epidemiology. And John Sadler and Mike Clagg, who in a room at Hopkins we designed the Choices for Healthy Outcomes in Caring for ESRD study, or the CHOICE study. And Keith Johnson of Dialysis Clinics Incorporated, who opened up his facilities to be a clinical laboratory for the CHOICE study, as well as Alan Kleiger and Fred Finkelstein and Nathan Levine. And Joe Korish, who had the insight before the human genome was completely sequenced to set up a specimen bank in the CHOICE study that now has allowed the investigation of molecular markers and as well as genetic determinants of kidney disease. And then a host of other colleagues and trainees, both at Hopkins and now my new institution, University of California, San Francisco, who are pictured on this slide. I was born and raised in this great city of Philadelphia. And I have the privilege of having my mother here in the audience this morning, who has offered me unwavering support and love over the years, for which I would not be on this podium today. And my brother is also here, who, like only a brother, can prepare you for the intellectual debates that you would have during your career and the grueling NIH critiques that you would receive. Dr. Scribner, in the later years of his life, was occupied with eliminating and addressing healthcare disparities. And I'm proud that I share that passion with him. So I thank you, ASN, for your support and for honoring me in this way. Thank you.